Okay, great. Hi, everyone. I am Mary Shomon, and I'm here on behalf of Paloma Health. I'm a editor and writer and working with Paloma to help spread the word about the amazing services. And I am a writer, patient advocate. I've written a number of books, and I have been, hold on one second, I'm getting a little feedback issue here. There we go. Okay, so we're live. I think it just went live, so I'm going to say it again. I'm Mary Shomon. I'm here for Paloma Health, and we are the nation's leading medical practice, virtual medical practice dedicated to hypothyroidism and women's hormonal health in perimenopause and menopause. We have amazing thyroid test kit available for home use. It's convenient, painless, tests all your thyroid information. We have incredible practitioners that are available for virtual visits. We have health coaches who can work with you on a day-to-day basis to get things going. And we also have incredible nutritional experts, and you're going to meet one of them today. And our topic today that we're going to be speaking about is weight loss and your thyroid and how nutrition can make a difference. This is an issue that is near and dear to all of us with thyroid issues for the most part, because most of us are trying to figure out, why did I gain weight when I became hypothyroid? Or why can't I lose weight? Or I used to be able to cut out a couple Cokes and some chips at lunch and lose 5 pounds. And now I'm working out, I'm eating very clean, and nothing's happening. So Nicole's going to help demystify that for us today. So our guest today is Nicole German Morgan, RDN, LD, CLT. She has every initial after her name that you can imagine, because she's that much of an expert on nutrition and diet and how it interacts with your thyroid. Nicole is actually a registered dietitian nutritionist, and she works with Paloma Health. So if you schedule a nutritional consultation, you're going to be meeting with Nicole. And she has over 15 years of experience as a dietitian and has worked in weight management and thyroid nutrition since the earliest days of her nutrition work. Nicole specializes in helping thyroid patients integrate nutritional therapies in order to optimize their thyroid treatment. And it's an important part of optimizing your thyroid. She also works with helping to support the thyroid management and treatment for ongoing hypothyroidism patients. She is author of a book called The Nourished Thyroid, a gluten-free and thyroid-friendly cookbook for all lifestyles. And I have to tell you, some of the recipes are out of this world in this cookbook. So you're going to definitely want to check it out. Nicole completed her education at the University of Georgia, where she earned her bachelor's degree in dietetics. And ever since then, she has been out in the field working hard, helping us thyroid patients get it figured out and helping us sort out exactly what we're doing right and what we might be doing wrong. So I am very happy to introduce Nicole, and Nicole's going to tell you a little bit more about herself and why thyroid and weight loss are near and dear to her heart as well. Thank you, Nicole.
Yes, thank you, Mary. Yes, so I've been working with patients who've been working on weight loss and thyroid things, since about 15 years ago. And at the time, so I have Hashimoto's myself, but at the time I wasn't yet diagnosed. It was a couple years later, so about a little over 10 years ago that I was diagnosed. And at the time, my first early days, I kept seeing a lot of patients on their chart. It kept listing Synthroid, hypothyroidism all the time. And I was working in a medical weight loss center. And I'm like, what is going on here? Why are all these patients on this medicine? And then turns out, I got diagnosed with Hashimoto's. And so luckily I was working with a provider at the time who knew a lot. So I learned from that provider and we kind of worked together and I learned so much. And so we were able to help a lot of people. But I've worked in all different scenarios. I've worked in fitness centers and now private practice and with Paloma. And so it's been great because we've been able to help so many people, see weight loss and feel better, especially feel better. That's been a big one. So I'm excited to kind of maybe debunk some myths and get some clarity on some of this today. And first, we're going to start with some of the most frequently asked questions that we get all the time. And I'm sure you've all been asking yourselves these things. And so we'll kind of go through some of those hot topics. So,
Sure.
yeah.
Absolutely. What I want to mention to people is if you would like to ask a question, we're going to go through some questions that are the common ones that are coming up, as Nicole mentioned. And so we'll be going through those really common questions. And after that, we will be opening it up to other questions from viewers. So anyone who's watching, feel free to put your questions in the chat, and we're monitoring the chat. So we'll be able to pick up your questions and share them with Nicole. So please feel free to plug in and answer, ask any questions that make any sense to you, and Nicole will help demystify things for us. So let's start with our first question, Nicole. As a thyroid coach, I've heard it 100 times, and you've probably heard it more than that. People just say, look, I'm doing everything and I can't lose weight. Or I used to be able to lose weight and now I can't. Or I used to cut out a few, treats and sweets and lose some weight. Nothing's happening now. Why does it seem so much harder for hypothyroid patients to lose weight, or even if they don't want to lose, to maintain and not gain when they're hypothyroid?
Yeah, so this can be due to a number of reasons, and that's why it's so tricky, because there could be multiple possible reasons, or they can be combined reasons. And so we really need to get a good detailed history of the patient, a good detailed report of what they're doing now. Well, what's their history? What have they gone through in their life? Because it could all be related, and there's a chance it could be about 5 different small things all combined that could help support metabolism and improve. And so one of the main ones, so if somebody has hypothyroidism, but they also have some form of autoimmune thyroid disorder or any autoimmune condition, that can potentially just cause more total inflammation in the body in some way, shape, or form, that then will kind of, we don't really know the full answer to this, but in a vague way, be affecting the metabolism and all the metabolic processes. So just having an autoimmune condition in general can make you susceptible to, disturbances in your digestive health as well. And so that also leads to another possible factor, is just overall digestive health. Perhaps, so with hypothyroidism, it gets very sluggish, and there can also be a lack of nutrient absorption. And sometimes it's this lack of absorption that is then not allowing our metabolism to work at its best. And also, if we're not even absorbing, maybe we're not absorbing our protein as well, perhaps because of the slow digestion or lack of absorption of some of these things. And so then that's affecting our ability to see good weight loss or good health. Another one, and then also now these days, we're getting more and more research that's showing us that there can be an imbalance of the good and bad bacteria. And if we have an overwhelming supply of the bad bacteria, we're seeing that can lead us to not achieving a healthy weight, just having this overwhelming amount of bad bacteria. And so that's more, we'll maybe hopefully find out more about that as maybe more research comes in, but that's a little newer research there. And then this actually, so there's another factor here. This I find is a big one, is we're dealing with a lot of low energy. So this low energy sometimes makes it very difficult to prep our meals and do that meal preparation and grocery shopping. Some people are so overwhelmingly fatigued that it makes it hard to do the things they need to do to be healthy. And sometimes that even leads to an increase in snacking. We're snacking on a lot of little things because we don't have time, or we're tired and we can't make the full meal or the healthy meal. So that can also lead to an imbalance in our protein, carbs, and fats, even, or nutrients, or maybe we're overeating and we're not realizing, just because of the fatigue and just going more off the snacks. Those are probably the biggest ones that I see that are connected with hypothyroidism specifically.
Now, I have a question, because you mentioned about nutrient absorption. And I sort of intuitively have sensed, and I've seen a little bit of information about this, but maybe you can explain it a little bit more. But when we have poor absorption, which is fairly well established as a symptom of hypothyroidism, because we often don't have enough hydrochloric acid or gastric juice to digest things properly, which means we can eat something that's healthy, but we may not be getting the nutrients out of it, that the body tries to make up for that by being hungrier. So we want to eat more to make up for the nutrients that we're not necessarily getting from the foods. Is that the case? Am I right in that interpretation?
Yeah, sometimes. And it can even just be this imbalance of acidity in the stomach that can even give people a false sense of their hunger levels can be off. So if the
Mhm.
acidity is kind of out of balance, it's hard to understand the hunger signals. So I get a lot of different responses from patients. Some patients say, "Oh, I've never feel hungry." And then other times they're just having a hard time even understanding the hunger signals even. And
Mhm.
so, yeah.
So there's because there's apparently like an imbalance in the leptin and the ghrelin,
Mhm.
the
Mhm.
hormones that make us feel
Mhm.
full or satisfied or hungry, et cetera, and things with the thyroid then can get in there and mess around with that, correct?
Yeah, if there's an
Okay.
imbalance, yeah. The
Okay.
acidity, yeah.
So you've been out in the field with thyroid patients, giving them nutritional advice for quite a while.
Mhm.
And what types of specific weight loss challenges are people coming to you with? What do they have to say to you when they say, "Help, Nicole, what do I do?" What are the types of challenges that you're most commonly hearing from thyroid patients?
Sure. So the big one is the meal preparation, where
Okay.
they're struggling with kind of ideas and knowing how to put things together quickly and get organized with the preparation of making meals, which is
Mhm.
definitely, yeah, that's very difficult for anybody, even if we have a busy life. And
Mhm.
then, so that's such a big one. And we often go over, kind of like quick and easy things that we can eat to make that process easier. And something that's big that I often recommend, and this is really important, is so our thinking about, well, where does our motivation to eat healthy come from? And if we keep that motivation strong, it's easier to do the meal prep. And the best way to do this is to be able to enjoy your food. So that's a good question to think is, am I even enjoying what I'm eating? And if not, if we increase the enjoyment of the food, oftentimes it's more likely we'll be more motivated and spend that extra 5 minutes or 10 minutes to chop something up because we'll be a little more excited to eat whatever the food is. So we
Mhm.
also work on the enjoyment of our food and usually pick maybe one or new fun recipes for the week to shop for or prepare. Keep it really small, really doable.
Mhm.
So that's a huge one. And then other challenges is the other challenge is sometimes people are just really overwhelmed and just really confused on knowing what to eat. Often that's the probably the second biggest thing is they come to me and they say, I have no idea what else to do. I've done it all. I've tried it all.
Mhm.
um, it would be great if you can just give me a list of what to eat and I'll do it.
Right. Tell me what to do.
um,
Tell me what to do.
yes. So I think there's just an overwhelming amount of misinformation or conflicting information out there, and everybody seems confused on what to do. So I think, and I often have a good way to kind of debunk some of that is just to think, okay, well, let's think about this from a plating your food perspective. Let's just think about, okay, let's make it super simple and figure out what do we put on the plate in the most basic way that is still healthy? And so, my general rule, this is an old school thing, but it
Yeah.
works really well. It simplifies it, gets rid of the confusion, is to think, okay, make half the plate veggies, especially at dinner time. Make half that plate veggies, any veggies you like, salads, frozen veggies, any veggies you like. And then that other half your plate, just divide it a quarter protein, a quarter carbohydrate source. If you
Mhm.
visually can kind of represent it like that, easy. You're probably going to see some changes right then and there if you do that.
Well, that's about as
Yeah.
easy as it gets, folks. Half your plate veggies, the one quarter of the plate
Yeah.
protein, one quarter of the plate some form of
Yeah.
carbohydrate.
Yeah.
Can't get much
Yeah.
simpler than that.
Yeah. Yeah.
Um, One of the things that we run into a lot, and I've been writing about thyroid disease for more than 20 years, and so there's always some new thing where people say, don't do this, do that, don't do this. This is dangerous, that's dangerous. And so there are a few things in the food area that we're often told, and they become almost dogma. But
Mhm.
I think people have gotten a little bit off track with them.
Yeah.
So one of these supposed rules that we're told is don't eat soy. We also hear don't eat raw goitrogenic foods at all, like spinach or broccoli. Just don't do them, don't do them. We also
Mhm.
hear everybody should be gluten free. Hands down, every thyroid patient should avoid gluten. And then we'll hear things like selenium is very high level in Brazil nuts. So everybody should eat lots of Brazil nuts. And every one of these things has some problems underneath
Right.
them.
Hmm.
So can we go through those
Yep.
issues? Let's start with
Yeah.
soy, first of
Yep.
all. Should we be
Hmm.
avoiding all soy completely, or is there some
Hmm.
other way through that particular issue?
These are really great topics because it's not a 100% set in stone rule at all. And so the soy one is very interesting because there can be some benefits as well, depending on the person and where they are um, in their life cycle and everything. So for example, so soy, yes, it can potentially lower thyroid hormone, but only if a person is eating this excessively and if they're having it like every single day and it's mostly just the soy protein, or especially if it's a really processed soy protein, like some kind of soy veggie burger kind of thing.
Mm-hmm.
If it's if it's we have soy maybe once a week, or have some edamame at a restaurant or something here or there, it's fine, unless now soy is a common allergen out there. So if you eat soy and something, you develop a rash or something happens after you eat soy, sure, we can be a little suspicious of that. So it's worth noting that piece just because it can be common, sure. And then, however, so women in our 40s, 50s, and beyond, sometimes a little bit of soy can be really helpful because it can help bind to some of these estrogen receptors, making women just feel a little better as
Mm-hmm.
the estrogen starts to get lower. Later in life. And so sometimes I find it's helpful to have just a little sprinkling here and there, and especially the whole food forms of soy. But yes, it is something to be mindful of because potentially it can lower thyroid hormone if you're doing something like soy protein shakes and bars all the time. And yeah, yeah. So it is something to be
Mm-hmm.
aware of.
Yeah,
Yeah.
what I've heard from some folks that have like looked at nutrition, and not specifically for thyroid patients, but just in general, they've said, look, soy is good, but avoid the GMO soy. You want to always go
Sure.
with non-genetically modified, and use it like the Asians do, as a condiment or as an
Yeah.
accompaniment, not as a primary protein. And so we're not going to have soy milk, soy shake, soy bars,
Yeah.
soy patties, and go, because I guess as Americans, we always think, well, if a little bit of soy is good, a whole lot of it's going to be even better. And that's the thing with soy, is you don't want to go overboard, as you mentioned, because then it can start really affecting our thyroid and our hormone balance, right?
Exactly. Exactly. Hmm.
Okay.
Hmm.
Now, what about the goitrogens? Because broccoli, cabbage, kale, spinach, these are the superfoods, right?
Hmm.
And
Oh, yeah.
we're told, oh, they're going to slow your thyroid down, or be careful about them. What's the real story on those
Yeah.
goitrogenic vegetables?
Sure. Yes. So they're amazing. They're wonderful. They're very healthy, right? These are our good, like broccoli, such a good go-to veggie, easy. Yes. So we do not want to eliminate these. And so something to note is, yes, it can lower thyroid hormone. Now there's a lot of research out there on this. In fact, they've come out with even the latest research I saw, and I have to review that study again, but it was something like if you cook it, it lowers it even more than we thought in the past. And
Okay.
so,
Wow. Good.
yeah, so the cooking seems to do a lot to get rid of some of those, get rid of the goitrogens. And
Mm-hmm.
so another thing is if you're taking in selenium, if you have some sort of selenium coming in, our body can better handle these foods. It can more easily process them and
Mm-hmm.
handle it.
Mm-hmm.
So generally I find they're not a problem unless we're having something like a kale juice all the time, or a huge kale salad where these are just examples of things people more commonly might eat a large quantity of,
Mm-hmm.
or something like a riced cauliflower bowl where it's very large amount of
Yeah.
the cauliflower, and then maybe you're eating it very frequently. So
Mm-hmm.
in that case, take breaks from it, rotate it. It goes back to our everything in moderation rule that
Right.
dietitians like to
Exactly.
say. Yeah.
Exactly.
But
One of the couple of years ago, I had a coaching client who's had a very stable thyroid level. Her TSH was really in a good place. She was doing very well. And then she started making a raw spinach smoothie every morning. And when you think about spinach, I mean, you get this giant bag and it cooks down to a small amount, and it juices down to a small amount. So she had a bag of spinach every day that she put in her Vitamix juicer and mixed in all such sort of good things. So this was nutritionally a wonderful thing to drink, but so much raw goitrogen. And all of a sudden, her TSH jumped a couple points. Within about a month, she got checked, and all of a sudden, she's like, "Why did my TSH go up?" And I was asking her, "What changed? Did you change anything?" And she's, "Yeah, I started juicing this, raw spinach and everything." And I said, "That's the tip. That's probably what it is." And actually, I had heard from somewhere, I don't even remember where I picked it up, but they said if you very lightly steam your broccoli, so that steam your spinach, the
Yeah.
cooking component, and then throw it in the freezer
Yeah.
after you've steamed it, it'll get hard and crunchy and cold, and it goes perfectly then back into a smoothie.
Yeah.
And you're going to still get the nutritional benefit, but you've deactivated some of that goitrogens. So
Mm-hmm.
I said to her, "I think you want to try this, and then we'll get you rechecked again." And she did, and her TSH had come right back into range where it needed
Yeah.
to be. And so I think the message that you're giving us is, don't cut these foods out.
Right.
Just don't make them your primary breakfast every day in a raw form, or don't overdo it. Just incorporate them in a healthy way. I mean, there's no reason you can't even have some raw broccoli in a salad,
Sure.
or I love that with a little bit of hummus or a little bit of a dip or something. It's just not something I'm going to eat every day.
Exactly. Yeah.
Okay. And what about the gluten-free bandwagon? Because so many of us are told, there's no question you should be gluten-free completely. But I'm not gluten-free. I watch my gluten intake because just too much of it, it's a lot of carbs.
Sure.
So I don't want to do that. But I don't really have a reaction or a problem with gluten. And I know other patients don't either. So what's your take on gluten? Should we all just categorically be gluten-free?
No. Yeah. So I even have some people, with Hashimoto's or any autoimmune condition where they can tolerate some wheat products and gluten and they're fine.
Mhm.
I would say that's more rare. I would say overall, and like an overwhelming amount of my patients will do better on a gluten-free diet. Mostly the ones that have the autoimmune form
Right.
of these conditions. So most people who have Hashimoto's or Graves' disease will overwhelmingly do better on a gluten-free diet. So it is, with the research that we have, it's not great right now. So right now I go off of these patient reports, and because such an overwhelming amount of my patients will do better on a gluten-free diet, I'm like, we'll give it a try. It's worth giving it a good solid 100% elimination try, and then see what happens when you add it back in. Do you have a significant severe symptom? Or when you eat gluten-free, are you getting, most reports I get are things like, I don't have the brain fog anymore, my bloating is less, my digestion is better. That's most common what I see. And so it's worth giving it a shot just to see how you feel. And then also maybe check your lab work after you go gluten-free too, and just see, is there also any change in the lab work? And if nothing changes at all, chances are it's something else that we're missing, or we have to look at another something else in your diet or lifestyle or supplements or something. But not everybody, but I would say majority do better.
Okay.
So,
Good.
yeah.
So,
Yeah.
and that's something that people can introduce slowly, because I mean, one of the misconceptions I think is if you have celiac disease, you need to be very religiously gluten-free. But if you have autoimmune disease, you can look at starting to cut back on gluten.
Right.
And you may have some benefits simply from that.
Right.
You don't have to necessarily completely eliminate all forms of gluten in order to reduce some inflammation or to start to feel a little bit better.
Right.
So I often tell people, look, if you're not celiac, where it's medically necessary to avoid it, anytime you can reduce the burden of things that your body reacts to, you're going to feel a little better. And we don't all have to become gluten-free, dairy-free, this free, that free. I mean, sometimes it's cutting back on the intake of those that gives you an extra edge.
Exactly. Yeah, exactly.
Mm-hmm. I'm noticing we have some questions coming in, so we're going through our sort of advanced questions. But please keep the questions coming, and we will get to those. We will have plenty of time to answer your questions. So please keep feeding them into the comments area in the live chat, so that we can have Nicole address your really good questions. Okay, one other question that we get all the time. I hear it, you hear it, everyone in Paloma hears it, and it's all over our community bulletin boards and community forums. What's the best diet for
Oh,
hypothyroid?
yes.
Like Nicole,
Yes.
you must know one of them really is the way to go. The rest of them, now, which is the secret best for us for weight loss? So tell us, is there a magic
Yeah.
secret diet that you just haven't shared with us yet?
Yeah. So, all registered dietitians, we hate the word diet and we hate to talk about one diet in particular as being like something you need to follow. However, if you want something to like wrap your brain around in a way to like think about this in a way to, yeah, just think about how do I approach this, or how do I think of this? I always say, think of it like a low gluten Mediterranean diet kind of
Mhm,
thing. And then that way it helps you focus on the whole foods, the proteins, and the olive oils, the healthy fats. And so it's a really nice whole foods mentality with, sure, for a good chunk of people that aren't tolerating wheat products, a little less of that.
mhm.
Um, is the best way to, I would say, think about it. Yeah.
So, and how you implement that is,
Sure.
well, that's certainly something that Nicole can help you with. If you're a
Yes.
pullover member, you'll be able to talk to Nicole and she'll help you come up with your own version of this that works
Mhm.
best for you. But in general, any one of the sort of pre-programmed diets out there. I mean, we have, the paleo diet, the low
Right.
carb diet, we have the autoimmune protocol diet, which is one of the ones that we uh, educate people on at Paloma because
Mhm.
it's very helpful for people with high antibodies and a high inflammatory load. There's just the anti-inflammatory diet, the Mediterranean diet, as you mentioned. There's so
Yeah.
many different variations of diets. There's the, low FODMAP diet. I mean, and we've written about all of these at our Paloma blog, so you can learn more about these if you're interested in finding out about all these different types of diets. But one size doesn't fit all for
Mhm.
people. And ultimately, the success point is going to come, I think, when you work with someone like Nicole to customize some of the best things, the anti-inflammatory components, the whole foods, the lots of vegetables, good fats, good proteins, that type of thing. And it's not always going to be something you're going to find out of a book or with 5 bullets that say, do this, don't do that, do this, don't do that. So I'm feeling like maybe people want to really talk to you and find out more about what's going on with this because they're
Yeah.
going to be able to get some insights into how this works.
Yes, yes. It's not one size fits all. Usually we have to just look at what you already eat and take that as a foundation and then modify it. And then we have this like perfect, way of eating. Yeah.
Okay, we have one more of our planned questions that came in from so many different forum posts and questions we've gotten at Paloma over the years. And then we're going to go to your questions, and they're still coming in. So thank you, everyone, for sharing your questions. So, Nicole, what are the most important nutrients for hypothyroid patients trying to lose weight or manage their weight and not gain? So here we're talking about vitamins, minerals, etc. What do we really need to have on board when we're hypothyroid and we want to ensure that our system can allow us to lose weight or maintain a healthy weight?
Mm-hmm. Right. So first, it's good to differentiate for what our nutrients are. Yes, we have our macronutrients, which are our carbs, fats, and proteins, and then we have our micronutrients, which are our vitamins and minerals. So I guess most importantly, the protein piece is what I come across the most often, meaning oftentimes we're just not getting enough total protein. And
Mhm.
so I would check this first. So 100%, go ahead and calculate it for yourself and see how many grams of protein am I getting on a average day, because you
Mhm.
might find it's lower than you think once you calculate it. But luckily, a lot of things have protein. Even our vegetables have protein. So you also might surprise yourself. There's a chance there. So how much protein do we need is another thing people ask. So um, at least this is a ballpark, so at least 75 grams of protein for most people. We want to get past that generally if we're
Mhm.
hypothyroid. You can calculate this, and this is something I can help with. Usually it's you need to find your weight in kilograms and then multiply your weight in kilograms times about 0.8 or 1.0. And that's going to be your minimum protein that you need to get for the day, bare minimum. Generally, we want to err on the side of a little more because we may be dealing with that inefficiency in our body, that slow digestion, the slow absorption, or just the human body can be not very efficient at breaking down these massive protein molecules. Proteins are very large structures, and it takes a lot to break them down and actually utilize them for our hormones. Our body will take protein and even use it to make thyroid hormone. So we want to make sure we're topped off. Now, you can overdo it. There can be too much protein, but it's quite rare. You'd have to be, I would tell you if you were eating too much, but that's pretty rare. And yeah, that's probably the most important. And then the minerals and the vitamins, I usually leave up to working with one-on-one with a dietitian who knows what your intake already is for your vitamins and minerals, and if you need more or less, because that's very patient specific and very not one of those in particular will automatically lead to weight loss. It's just trying to figure out, are you deficient or do we need to support it for some reason or for a certain health condition? So that one's a little trickier.
I want to mention that one thing that we do have, Paloma has a supplement, our daily thyroid support supplement, and that has a number of vitamins and minerals in it that are designed to just support healthy thyroid function. And it's not a overdosage. It's not mega doses of these vitamins. It's just making sure that you are, as you said, topping off the levels of the most important nutrients for the healthy, happy thyroid in general. And beyond that, as Nicole is saying, when you're looking at like, do I need iodine? A lot of times you go to the Whole Food store or something and you talk to the clerk and they don't really have a nutritional education, but they know thyroid. Oh, you need iodine. And sometimes that's putting fuel on the fire for thyroid patients. We don't need extra iodine in some cases. Or they'll say, take kelp, take bladderwrack, take this, take that. You'll hear all sorts of crazy recommendations for vitamins, minerals, botanicals, herbal supplements. And so I caution people to be very careful. Talk to your practitioner, talk to Nicole, talk to someone that knows how this works for you, because otherwise you can actually get into trouble and make things worse. I've coached with thyroid patients who came and said, oh, I read this article and now I'm taking 12 grams of iodine a day. And I'm like, what? No. And they said, and my neck blew up and got all swollen, and they were going into a thyroiditis because they had too much iodine. And so people need to understand that it is, again, this is your mileage may vary situation. You don't know exactly what combination specifically of supplements is going to be best for you. But I think people can't go wrong with the thyroid support supplement to help just keep the thyroid supported. But that's not going to necessarily kick into weight loss. That really would require a little bit of extra attention to the nutrients, correct?
Correct. Yeah.
Okay. And one last question I do have, or maybe we can circle around to it later, because you were talking a little bit about some of the ways we can do meal prep to simplify things.
Oh, yeah.
So I'm gonna put that on the list, and we'll come back around after we've touched base with a couple of the questions that we've gotten from viewers today, because that's something I want to hear about, because I'm too quick to call for takeout or something when there may be ways that I could be doing things much more simply and eating more healthy. Okay, so we're going to go to a question from Danielle, who wanted to know, as part of your practice, do you order stool testing to determine absorption and bacteria levels? And if not, how do you go about making this determination?
Okay, so there is a wonderful company called Diagnostic Solutions, and they have a wonderful GI map stool test that is very comprehensive. It'll tell you everything: the pathogens, the balances, the bacteria. I do partner with that company, so it is a test that I am able to order. And if you see me with Paloma Health, I can still order that separately. It wouldn't be through Paloma, but I can order it separately for you. So I can help you with that. Yep. And I
Mhm.
review those all the time. I have one today I have to review. So I review those all the time. And it is something that is worth it to do at least once in your lifetime, because it will also it'll tell you, it'll give you insight to kind of this microbiome that you were potentially born with. And so it does give you that foundation of understanding what's going on.
Mhm.
Yeah.
Well, I know we just did there was just a study that came out, and we did an article on the Paloma blog about a number of probiotic bacteria, and not the common ones, not the acidophilus and the bifidobacterium types of things, but these are the more obscure ones that actually are protective against Hashimoto's and hypothyroidism. And some of them can be supplemented, but not all of them. Some of them are only built, you can only build them up in your body by eating more of certain kinds of foods. And so it sounds to me like if the stool testing can also kick back to you, hey, you have overgrowth of this type of bacteria, or you don't have enough of another type of bacteria. And it can also help as far as advising on probiotic supplements and
Correct.
food that may help feed the good bacteria, correct?
Correct. Yes. And that can help prevent you from taking some probiotic that does nothing or
Right.
potentially is harmful even for some. And so it can just help ensure that you're doing the right specific thing for your body. Yeah.
Mhm. Good. Okay. Danielle also has another question, and this is a common one that we often hear. Danielle's been gluten-free, dairy-free, caffeine-free, 80 per eating food 80% unprocessed free or processed free foods, cardio and strength training, and she gained 50 pounds in 10 months without a single change. So what could be going on here? Now, Danielle, if you're
Sure.
still on, tell us, are you being treated for hypothyroidism? Because I definitely want to establish that. I mean, I'm assuming, and you're probably going to assume she's already got a thyroid condition, but Danielle, have you been evaluated and treated? If you can put that in the chat for us, if you're still listening to us. Otherwise, but Nicole, tell us what that situation tells you.
Sure. So this is very common. This is a very common scenario. Probably, at least half or more probably of the people that come to me. This is almost the same kind of scenario. So at this point, we're like, okay, something in the body has gone wrong, right? So we now have to troubleshoot. And so for our troubleshooting, we have to check all the different areas of health. So I usually start with having you write down, everything you're eating in your day. I'll listen to you give me feedback just orally, say what you had yesterday. But it's better if then you go ahead and write it down as you eat it day by day, just so we can spot check and check, okay, what's also the timing of your eating? Is it how many meals a day are we eating? What time of day? Because sometimes that can play a role as well. And then also, I would hear about your symptoms. The symptom report is so helpful. So I'll want to even know about, mild symptoms, but really the things that, of any symptoms that are bothering you the most. And sometimes if people say, I don't have many symptoms, what I'll then do is I'll give you a symptom survey to fill out, and it asks you about a lot of small things that you may not even realize are a symptom. So because the symptoms can help guide us as healthcare professionals, it can help guide us in how to help you, and it helps give us insight. Okay, maybe this is going wrong or this is going wrong. And so like I was saying earlier, sometimes it can be 5 or more small little things that are not quite going right in the body that we need to optimize, and then the metabolism is going strong again. And so we have to usually just assess all the different things. So yeah, food journal, we would do short term just for a little bit, and then check all the symptoms thoroughly, check your lab work. Maybe your lab work wasn't complete. Maybe we need to do a few extra labs to get more information. Maybe we're just missing information. So we're very thorough. We have to find what's been missing or what hasn't been. Yeah.
And Danielle did add in. She said, yes, she's got Hashimoto's, but she's in range.
Sure.
And here, I would sort of jump in and add, you can be in range, but that's not necessarily optimal.
Correct.
Because we need to know where your sweet spot is. Because, the range is wide. And I have a doctor friend who always said, the TSH range and the thyroid levels range are like shoe sizes. A typical woman's shoe can be from size 7 to a size 11, But if I have a size 11 foot and you hand me a size 7 shoe and say, here, this is normal, I can't get my foot into it. And so everyone doesn't operate ideally at the same thyroid level. And the vast majority of the healthy population of women have TSH levels that are lower than what is the middle point of the range. So we tend to do better when we're a little bit in the lower end. So we need to know where those TSH levels and free T3 and free T4 levels are too, to know whether you're being optimally treated, because the nutrition can help. But if you're operating with a slowed down metabolism because your thyroid's not optimal, I mean, that's pretty much it's going to hold you out of the gate, right?
Yes. And I will say, people ask me this question all the time, like if I have hypothyroidism, like, and it's not well optimized, let's say it's still a little, they're working on optimizing it, the levels, you can still lose weight. It's not hopeless, but it just will be slower or more difficult. And you want to have that expectation. You also want to have the expectation, like, yes, you may deal with a few more water weight fluctuations, and it may not always purely be pounds of actual fat mass that are going up or down. It could be a little water weight fluctuation from just being still a little hypothyroid. So, yeah.
Well, I mean, I've also heard some thyroid patients ask, well, isn't thyroid like diet pills, really? I mean, once I start on it, isn't the weight going to magically fall off of me?
No.
And I mean, my understanding is that all it does is it's leveling the playing field a little bit more.
Yes.
So good health, diet, and exercise can actually work instead of being hopeless.
Right. Exactly.
Okay. So what's your advice for Danielle?
Oh,
if
sure.
she needs to sign up as a Paloma member and have a consultation with you.
Yes. So do a food journal for just a couple days. Do it like 5 days or so. Plug it into, it could be any food journal. It could even be, if you don't want to plug it into an app, you can plug it, you can just write it all down, but be as detailed as possible. I even have people, if they don't like doing that, I'm like, just take pictures of everything and put it in a document, send it to me. And if you are about to meet with me as a first-time patient, if you have some of that information already ready to go, like a food journal or something like that, that's even more helpful. And yeah, because usually I've looked at these food journals and written journals and app journals for, the last 15 years. So I can look at it very quickly and be able to spot XYZ, like this, we just need to add a little more of, or take away from, or change the timing, so it'll be very easy for me to help do like little spot checks on it. And usually it's not a huge overhaul of anything. Usually, like I said, it's a lot of small things that we just need to fine tune. Yeah.
Great. Well, Danielle, I think you have some advice here to get started and some ideas on things that you can get started doing. So we hope, if you're not already a member, we hope you will be joining us at some point soon. We also have a question from CD, who says, do you have experience assisting in weight loss for us with Hashimoto's along with multiple other chronic illnesses? And this is a common situation for CD. She also has mast cell activation syndrome, reactive hypoglycemia. Oftentimes we see people, like in my case, I have Hashimoto's. I also have type 1 insulin dependent diabetes. Other people I know have psoriatic arthritis and thyroid. There's lots of different combinations of chronic illnesses that we see in tandem with the Hashimoto's and the hypothyroidism. So what are your thoughts about when we start complicating the situation with additional chronic or autoimmune conditions?
Right. Yes. And so usually I can help with these things. I've probably seen it before. So most of the time, even if it's something a little more rare, I've probably seen it. I've probably worked with it. But you're always welcome to message us or ask us if I've seen this before. You can ask one of our care managers as well, and they might be able to ask me the question and find out for you too. But like the ones you mentioned, I've worked with those conditions, absolutely. And it's a lot of, you'd be surprised, because a lot of these same conditions that there's a lot of similarity in the conditions that go hand in hand with Hashimoto's or hypothyroidism. There's a lot of similar disease states and conditions. So we've probably seen it. And and so when we think about, well, what do we address? What do we start with? We always, for nutrition, we start with, okay, well, what is the most effective nutrition therapy for which condition first? Which one will get you better first? Because then it kind of snowballs. If we can get one part of you better first, those symptoms improve, and then you're able to maybe just have a better quality of life as well. And then you can more easily do things like the meal prep, and it'll be easier for you to get along. And then so that's where I always am big about listening to the symptoms and having you tell me what's bothering you the most, because then we'll try to tackle that thing first, so that you can do your activity, you can do your exercise, and
Right.
yeah.
Well,
Yeah.
and if you're feeling better, that it also gives you more
Oh, yeah.
motivation to do the other things in the bigger picture of activities. Because one of the things I think we all believe at Paloma is it's not just throwing medication at it, or it's not just a dietary change. It's a combination of medications for your hypothyroidism when needed, and nutritional changes and lifestyle changes. I mean, nothing's going to cure your fatigue with hypothyroidism if you're not getting enough sleep.
Correct.
There are some very basic guidelines that are taking care of ourselves that are going to help us feel better as Hashimoto's and or hypothyroid patients. Okay, so we had Danielle say she's already a member, but she'll be scheduling. So I think
Oh,
you'll be
great.
hearing from
Yeah.
Danielle at some point, Nicole, so that you can help her work through some of her questions and see if she can't get that weight gain back on the track where she wants
Yeah.
to be doing. CD also has Ehlers-Danlos syndrome, POTS, that's postural orthostatic tachycardia, and she's got chronic fatigue syndrome. So exercise has been near impossible. So yeah, that's a good question. Where I know that you're the nutrition guru, but where does exercise come into this? Because we often hear you're never going to lose weight even if you diet without exercise. Is that true, or is there some other place in there that you can explain it for us?
Sure. So all this is also, and it also depends on your age as well, because after age 35, our body, it has a harder time either putting on muscle mass or maintaining muscle mass progressively over the years. So that's also something I look into. Okay, well, what is your age? What is your history with exercise? Your history matters too, because that helps us understand what muscle mass you already have. And muscle fuels that metabolism. So if we're going to get the best bang for our buck, we want to do some strength training. And any tiny bit of strength training will help. If you only have 5 minutes and that's all the energy you have, it will help. So if you're like, I'm going to, just pull these weights up and down for 5 minutes, that is still incredibly helpful. And it's a great place to start. Yoga is fantastic because it's generally something you can handle every day. And it does incorporate a little strengthening, and it's moving your body in all different ways. The movement is what's most important. Like, how much total body movement and what different types of movement can you get for your body? So even something like a stretch is incredibly helpful, because it's not going to be burning a lot of calories, but your body, it'll be great for your body. It'll help tell your body, send these signals to your body of, hey, this person's getting some movement. It'll help your energy temporarily because it'll improve your circulation. So don't feel bad if you can't do 30 minutes. I mean, 5-10 minutes a day, if you can do it every single day, that's what matters. Try to keep it an everyday thing. So it gets in your routine, it gets in your habit. But I would say if you have to pick and choose, go for the strength training, even if it's using body weight or bands or something light, it's fine as long as you're starting small. Yeah.
I agree wholeheartely. I am the least athletic person you'll ever see, and I do not like the gym. But one of the things that I like to do is I have some like 5-pound hand weights, and I have some stretchy exercise bands, and I keep the hand weights in the kitchen. So whenever I go in to put a cup of tea into the microwave or to start cooking something, I stop and I do the hand weights. I'll do 5 minutes, and I can break it up so that throughout the day I end up doing 20 or 30 minutes of something. I'll also use the stretchy bands when I'm watching TV. So I'll just sit there and stretch and do up, down, put my leg in it, stretch it in and out. And like you said, everything counts. So I don't necessarily have to go to the gym to work on a machine to get the benefit. And you and I are both in Florida right now. I'm usually in Washington, D.C., but I'm in Key West right now. So every day I'm getting in the pool, and
Nice.
water walking, and I'm using some floats to do some water resistance things. And it just feels great because it's moving, it's stretching.
Movement.
I'm not going to end up being Wonder Woman, but that's not my goal. My goal is to just keep things moving and flowing and strong. And, so however you do it, whether it's walking, bands, little mini movements throughout the day, do your best to fit it all in during the day. So,
Yeah.
let's see. CD said she used to be very active outdoors in the gym, yoga, strength training, but the Ehlers-Danlos is hard because that makes the joints very unstable. The POTS makes you dizzy, so you don't want to be standing up, and the chronic fatigue there are things that CD could even be doing in bed gently, correct?
Sure, absolutely. Yeah. And a lot of floor exercises. Exercises, another thing that's become popular is doing exercises just against a wall, or on a mat, or in the bed. Yeah, there's a lot of stuff you can do. But you don't have to push it.
Yeah. And really with something like chronic fatigue, you shouldn't push it.
No.
Because you don't want to push you into adrenal crash or adrenal fatigue.
Yeah.
So, for example, we had him as a guest on talking about long COVID and COVID response. But Dr. Jacob Teitelbaum, who's an expert on chronic fatigue, he always says exercise to your ability.
Correct.
So if the only exercise you can do is sit in bed and do some bicycles with your leg, or lift a couple of hand weights while you're watching TV from your comfy chair, those are good. It's something, any kind of movement you can. Okay, CD, Danielle wants to be your best friend. So maybe you two can connect. Don't forget, we have a very active community on Paloma where you can share information and meet other patients. We have a few patient advocates who are really wonderful, sharing their information in the community as well. So I invite anybody, and you do not have to be a Paloma member or seeing our practitioners to participate in our community. It's an open community for anyone. All you have to do is just register for the community, and there's no charge at all. Same thing with our Paloma app, which allows you to track your symptoms. It allows you to learn about and follow the guidelines for the autoimmune protocol diet, and access various aspects of care if you are a Paloma member. So it has so many incredible features that you can take advantage of. And I think there's even a way to book an appointment with Nicole right from the app. So,
correct. Yep.
So I think we are coming to the end of the hour. So I think we're going to go ahead and start wrapping up. And CD and Danielle are having a chit chat now. They've connected. They're sharing screen names and interchanging information. So this is wonderful. This is what getting well and living well is all about. It's making connections, learning from people like Nicole, learning from each other, and taking that information and taking it forward so that we can really, really live well and feel well. So I want to invite anyone who is watching, whether you're watching live or whether you're watching on a replay, to take this opportunity to join the Paloma community by becoming a Paloma member as well. You can get a Paloma membership, which allows you very affordable access to our doctors, practitioners, health coaches, nutritional gurus like Nicole, and test kit. You can get a discount of $30 off a new membership with Paloma, or off a test kit for your thyroid blood work with the discount code YouTube. That's YouTube in all capital letters. Again, just to remind you, Paloma has a comprehensive approach to your thyroid care. So you have practitioners, you have home test kits that are certified laboratory test kits. You have a nutritional supplement. You have hundreds of articles in our blog with every possible kind of topic you can imagine. Our community, our access to all the coaches and the nutritional experts, and a nation of really incredible practitioners. I know some of them. Nicole knows some of them. We've met a few of them, personally, and worked with them one-on-one. These folks are amazing. They're absolutely wonderful. And we have a very high remarks and regard from all of the people that are working with our Paloma doctors. They love them. It's life-changing to be with someone who understands your thyroid condition and truly gets it. So we invite you to become a Paloma member with that discount code. Save yourself $30. Stay tuned if you sign on to our YouTube channel. And you'll get notifications for upcoming events when we go live to do future speaker series events or even short mini interviews that we do occasionally. You can also sign up for our Paloma newsletter at our website, which is www.palomahealth.com. And our newsletter comes out and provides lots of information. And you'll also be the first to know when we have special opportunities and additional sales on services and new developments and offerings that we're constantly expanding our ability to serve clients and patients and be able to really help you get to a place where you feel well. So we have one more comment. CD says, thank you both for doing this webinar. This is really helpful. I've been a Paloma member for 2.5 years and I love it. Well, CD, we're so glad you love it. We love you. And thank you for participating today. And Nicole, did you have anything that you wanted to close out with at this point before we finish up and sign off?
Sure. Yeah. Just thanks for having me so that we can clear up some of these myths and topics and get some clarity on it and a little guidance for a pathway forward. And yeah, you can book appointments with me right on your Paloma dashboard if you're a member, or right on the Paloma website. There's a lot of buttons on the website where you can, and on the blogs, there's a button to book an appointment with me. It'll say book with nutritionist, but once you click through, it'll be with me. So, but yeah, thank you for having me.
Well, it's been wonderful. You've been just a complete fountain of wonderful information. And I can't imagine anyone watching this who wouldn't want to turn around and book with you like right now, because I want to book with you. So I think I'll be talking with you privately at some point soon, Nicole, as well. So in any case, thank you everyone for joining in. Thanks for the great questions, and keep in touch with us because we will be having some future events with lots of great information that's meant to empower you to really take every possible advantage of all the good things that you can do to keep your health in good condition. So we wish you to live well, feel well, and have a great weekend, because we're coming up on the weekend now. So enjoy your weekend, everyone. Get some relaxation, have some fun. And thanks again to Nicole for her incredible contribution today. And thanks to everyone who joined us. And this has been Paloma Health, our speaker series event. So we are going to sign off. Thanks, everyone. Bye-bye.